Hello everyone, Namaste. So today's topic we are going to discuss is addiction. So addiction is also considered as one of the psychological disorder. So we'll be discussing about the addiction today. So addiction means getting addicted to the substances. So those substances are called as psychoactive substances which creates imbalance in our psychological aspects. So which is more active, which leads to lots of disturbances. Okay, so intake of psychoactive substances on a regular basis for a full day, increased quantity, that which affects a physical and mental health of a person, and also a person feels that he is going to die without that particular substances. Okay, so that is called as addiction. So in order to call a person is addicted to substances, he should consume a addiction, or he should consume a substances on a regular basis, everyday basis, and later from a night it goes to afternoon, from afternoon it goes to morning. So it is like for a full day he'll be consuming, and never the quantity of a substances decreases in addiction. It is always an increased quantity of addiction, increased quantity of intake, and then effects on physical and mental health of a person. So continuous intake of these substances affects very badly on physical health of a person and also a mental health of a person. And along with that, the person feels that he cannot lead a life without that particular substance or a group of substance, or he feels he is going to die without that. Okay, so that a particular stage is called as addiction. So there are different types of substances like alcohol, nicotine, ganja, gutka, some illegal drugs like cocaine, heroin, brown sugar, many, and prescribed drugs. Also, a person can addict to these kind of prescribed drugs, like maybe it is a medication. At times, a doctor suggests a few of the medicines for the purpose of improving the health. For example, maybe a person will be having sleeplessness, so he won't be getting a proper sleep. That's why the doctor have prescribed some sleeping pills for a particular days. Okay, and even doctor compulsory tells a patient to come for a follow up, and doctor has a plan to stop it. But once patient start consuming it, he feels good and he feels little relaxed because of that medication, and without a doctor's prescription he continues by himself. So that becomes an addiction later. So there are many of the medicines which are prescribed by the doctors, and they are asked them to ask the patient to stop it after a few days after a course, but the patient will not stop it. He will get into addiction with those medicines. So that is prescribed drugs. Okay, so after seeing the types of substances, we will see different stages under addiction. So there is substance intoxication stage and substance withdrawal stage. Substance intoxication stage is that when a person is addicted. For example, he is addicted to alcohol or any of smoking or any of the drugs. So when he is consuming it, that particular days, that particular stage is called as substance intoxication. And substance withdrawal is that when he stops intake of those substances. Once he stops it, so later stage after stopping, a symptoms which occurs in a person is called as substance withdrawal symptoms, and that stage is called as substance withdrawal stage. Okay, we'll see what are the symptoms of substance intoxication. So person will be feeling drowsiness, so full time being sleepy, and slurred speech, speech won't be clear, and memory problems, he'll forget the things very soon. Irritability, will be having lots of agitation, irritability, gets anger for very silly reason. Involuntary eye movements, there will be improper eye movements. Along with that, there will be poor coordination, so unable to walk properly, unable to do his work properly because of intoxication. So these are the symptoms which you can see when a person is consuming a particular substances. Substance withdrawal is the next stage once he stops the substances. So during that time he'll be having insomnia, that is sleeplessness, irritability also will be present, and there will be mood fluctuation. For no reason he becomes very sad, starts crying, maybe at times he'll be happy for no reason, and there will be depression, feels very depressed, having anxiety, and there will be nausea, vomiting sensation will be there, and body pains will be there, at times confusion too, Then also he'll be having psychotic symptoms, maybe like talking to himself, maybe hearing the hearing the voices which is not actually present, seeing the images which is not actually present, having suspiciousness. So all these are the substance withdrawal symptoms. You may be having a question, even when a person is consuming a substances, he'll be having problem. Once person stops consuming a substances, also he'll be having problem. So what is the use in stopping the alcohol or stopping any of the substances? Because in both the stages there'll be problem. But you should know it. It is very important thing to know that the substance intoxication symptoms will be permanent, and there will be organ failures also when a person is consuming a substance. In substance withdrawal stages, temporary, and the symptoms are temporary, and it can be treated very well. Okay, so that's why you should see where is the permanent loss and where is the temporary disturbances. So temporary disturbances are better than a permanent loss. So substance withdrawal symptoms can be handled very soon, maybe for 1 week, maybe for 15 days, he'll become better under the proper treatment, under the proper medication. But the symptoms of substance intoxication will be lifelong and permanent, and it cannot be repairable. You cannot repair it. Okay. Causes. So these causes are actually just reasons for addiction person, and these are all the causes actually we collected from addiction patients only, that they say why they start doing addiction, they say why they are maintaining their addiction. So they say they started because of curiosity. So how it will be, what it will be, just with the curiosity they have started. And sometimes because of peer pressure, like in a group everybody are consuming alcohol, everybody are smoking, and only the person who is not smoking, so others will create a pressure on him to consume it, to inhale or to start intake of it, to maintain a status. At times a person who is not having a habits, when he goes to some parties, when he goes to some dinner outside function, when everybody are doing it, so it is like a sign of a status. It is like a kind of a he wanted to maintain his status by consuming, by showing that he can also smoke, or he smokes cigar, or he takes a very costly alcohol. So it's a sign of status for a person, actually not. Easy availability. So easy availability also at times encourages a person to consume substances. So a person stays in a very remote area where he cannot have a like bar or any shops where they sell cigarettes or something. He will not get it. Then he feels, oh, it's okay, it is not there. When I go to town, I'll get it. If he is really interested, okay. So he feels like it's okay tomorrow. If he really addicted, or a kind of a person, or things which are shop is nearby or bar is nearby, which motivates a person to take it on a regular basis, even though he had no plans to take it. Okay, he just coming in front of a bar. Actually, till then he had no plans of taking alcohol, but when he came in front of a bar, he feel like taking it. So easy availability at times encourages a person to purchase a substance and to consume. Cultural influence, at times it is because of some, maybe at some places or at some cultures, it is actually followed as a, what I can say, it is followed as a norm, it is followed as a rule that he should consume it during this particular festival, during a festivals where non-veg is prepared. So that time it is very normal that everybody consumes alcohol. So it becomes a cultural influence at times, and with that influence, the person has started it, later it becomes a habit. Then because of a nature of work, it's said that a stress or a tension in a particular work will make a person to addicted to these kind of substances. Is there any work there is no stress? Is there any work there is no tension? All work has tension. Even a homemaker, even a housewife have lots of tension than anybody else. Okay, so full day without leave, without salary, she has to work. So that is a stressful job. Okay, and why, like they will not feel like they are stressed and they have to consume alcohol. Okay, so it is just a reason. Nature of a work is just a reason. A stress is just a reason. There are many things to come out of a stress. Okay, even regarding that also we'll be going to make a video, so you will be knowing what are the very good things which can be adapted to overcome the stress, tension and anxiety. Okay, then the psychological problems, some of the things, some of the issues maybe which made a person depressed, which made a person anxious, that also leads to addiction. And social factors at times, being rich, being poor, being unemployed, all these things influences the addiction. But finally what I can say is, a person who wants to do addiction will give lot many causes, and person who doesn't want to make a addiction, so he has lot many things to overcome all these problems. Okay, so causes are just things which they want to what I can say, they want to defend themselves. Okay, lastly it is a treatment. So medications are very much important, as I said, in both the stages, like substance intoxication and substance withdrawal. In both the stages there will be health issues, there will be psychological issues, so medications are very much important to handle that. And stopping a habit which was there for long term, and all of a suddenly stopping any of the habit may leads to physical problems or psychological problems. That's why it is very important to a person to go to doctor and take a medication, get hospitalized sometimes. Otherwise, with the OP basis, maybe outpatient basis, he can go to a doctor and take a medication and stop his habit. And after a course of time, if he changes his lifestyle, so he can stop the medications too and stop the habits too. Then psychotherapy, there are different or many effective therapies under psychology, so which will help a person to overcome addiction. And group sessions, where we can go the very effective group session like alcohol anonymous group, where a person who had addiction before and had lots of problem and left it, now leading a very good life, will suggest lots of tips to a person who wants to quit it. So it will be a group of people who wanted to quit now, who had already quit addiction and leading a good life, will be giving suggestions to other persons, will be motivating others. And self-help groups, where a person who is having addiction wants to quit it, so they will make a group and they will share their feelings, they will share their problems, they will share the tips to overcome it. And rehabilitation service also helps so much, because rehabilitation service, where a person will be in a rehabilitation center taking a treatment for a de-addiction aspect, taking a therapies for a de-addiction, taking medications, and there will be a environment where there will be no availability of substances, there will be no person who will consuming the substances, so he will not feel like there will be no encouragement for the substances. So it will be a very good healthy environment where a rehabilitation centers help a person to overcome it. So all these treatment will work for sure if a person has at least a 5% of voluntary thing to quit a habit. Okay, so by this I'll be going to end the session, and there are many other tips, many other therapies to overcome the addiction. So we'll be having a separate videos too about the therapies of overcoming the addiction. So hopefully all these videos which we are releasing will be informative, and please subscribe to our channel very soon for a more and more interesting topics. Thank you so much.